Since using SuperPath and making the switch over to SuperPath, I've definitely noticed an increase in patient interest in the procedure. The word of mouth has been spreading. The physical therapists in the area are referring patients directly to me now because of that. They'll see a patient in the clinic and in their office, and they'll say, listen, Dr. Lugo's doing this procedure. You should go talk to him about it. I've seen the post-ops. All the physical therapists in the hospital are always stopping me in the hallway and asking me, what are you doing different? Is this something that everybody's doing? How come nobody else is doing it? And so it definitely has grown my practice in terms of being able to provide more service for the patients.
I have seen an incredible increase in the number of patients that are coming to me because they have learned about SuperPath. And so they have searched me out. I've had people coming from different states, Alaska. I have a patient tomorrow. I haven't met him yet because he's coming from Canada. So these are people that are very interested in trying these new methods that appear to have a lot quicker recovery than the standard techniques. So my practice has had a lot of people coming from different areas that normally I don't pull from.
So the typical orthopedic surgeon that does joint replacement will do 2 or 3 times as many knees as they do hips. I'm completely the opposite. I do twice as many hips as I do knees. Some people are drawn to the idea of the SuperPath, and my results have kind of spoken for the rest of it. So, patients are huge as far as word of mouth is concerned. Once they've had one done, they send their friends in. When I do send people to physical therapy, the physical therapists are my second best referral source. They think, what the heck's going on with this patient? It's different, it's new, and the nurses are as well a great, on the floor, are a great referral source. And so you just start seeing a lot more people just because you're actually producing results that are fairly remarkable compared to what your partners might be doing. Financially, it's made a huge difference for my practice. It's made it my practice is more an autopilot. I don't have to fight for patients. I always have people coming into clinic that need to get their hip replaced, and there's a comfort obviously in knowing that you're not booking next week's surgeries. You're booking 3 months from now.
Well, the impact it's had on my practice is just happy patients. And as any physician will attest, that's probably the thing that's most important. No one likes to wake up in the morning on their way into clinic and worried about, what patient they're going to see and whether or not they're pleased. It's very nice and gratifying to see patients after surgery who are pleased and happy with their decision, not only to proceed with SuperPath, but you as a surgeon. And it's certainly generated more business as word gets out and patients talk to friends and family members. Referring physicians are learning too that this is something that's quite unique, the patients are benefiting from, and so there has been definite pickup from that standpoint.
The impact of SuperPath on my practice has been less complications. What happens is that we see a lot less transfusions, we see a lot less dislocations, and more importantly, in my practice, infections have disappeared.
The SuperPath has impacted my practice in a way that it probably is hard to quantify for other surgeons, and that's because as soon as I started my practice, I was using SuperPath. So it's very, very hard to determine how much of my practice is based on the generation of SuperPath, how much of it is based on, maybe me as an individual, how lucky I have been, and where I'm practicing and with whom. I would say that SuperPath has certainly given me an edge in terms of my market presence. I can do things with SuperPath that many colleagues that are not able to do SuperPath with can do. Like, for example, just yesterday I did a revision where I changed out the ball and a liner, something very simple to do. In most surgeons' hands, that would require a second thought before committing, because you have to damage muscle when you do it. The patient has to go through an extended recovery, even if the work itself is not that big. And you can do that easily with SuperPath. And I wouldn't even blink twice about it, because that patient is immediately better, immediately up and walking, and feeling as though they really they had an outpatient procedure. They really barely needed to do much. And on my hands, it's pretty easy. It's it's just over a 45-minute procedure just to do that. So these are things that it starts making you reevaluate how you think about addressing long-term maintenance of hip replacements.